and big data. I'm going to be talking about how simulation models, as a particular powerful construct within system science, can be used together with the sorts of data we've been talking about collecting here. And I noted on the first day much of my motivations for exploring this work in the form of addressing complex health and social policy challenges. These are challenges which motivate simultaneously the approaches that we've been talking about here and the sort of dynamic modeling methods that I'll be introducing within this talk. The reflection from a system science perspective that motivates the use of models is that these challenges and the troubling patterns that are associated with them arise from processes that underlie them. The data that we see that suggests ever-growing rates of STIs, that suggests rising rates of obesity, that is suggested of the growing number of syndemics between multiple conditions. That data is resulting from processes that are epidemiologic and social in character, and they're causally tangled. If we want to understand how to best address the challenges of obesity in communities, we have to do so in a way that recognizes the entangled nature of many of the biomedical issues together with the issues of urban design, issues of the food environment, challenges associated with the differential pricing we see due to agriculture policy and how it impacts relative prices of healthy and less healthy foods. And there's a variety of factors at many different levels, from the level of the individual and successively higher levels of nested context, which shape the patterns we see epidemiologically and the growing burdens of many conditions, and that lead to the troubling rise in terms of antibiotic resistance and of new and emerging diseases, globally speaking. Many of these features are shaped by interaction of underlying factors that are diverse in character. And to really understand where these patterns come from, these patterns of growing health burden, and most importantly, how we can most effectively ameliorate them, the idea that motivates much of system science is we need to reason consistently about processes that underlie these patterns. It's not enough to merely study the associations, to study the patterns over time that we see. We need to know something about what is going on in order to change that, and particularly to reason about those counterfactuals. If we were to put an intervention in place, how would it lower those burdens? Now, when we talk about system science, some of you may be more familiar with that term than others, and so I'm going to be assuming here little previous exposure to system science. I sometimes describe system science as kind of the science of the whole. It's a science we use to study systems where the whole is greater than the sum of the parts, where to understand the behavior of the whole system or of big parts of the system, we can't merely understand the pieces of a system. That's not enough. It's important, it's valuable, but it's not enough for us to anticipate with confidence how that system will evolve, or more importantly, how it would change if we were to intervene in different fashions. And a hallmark of these systems is what's sometimes termed emergent behavior, surprising behavior that results. If we understand those pieces, each in isolation, we can still be surprised by the whole. It's kind of like a traffic jam. You can be an expert in everything mechanically about cars and about roads and their design at an engineering level, but you'll know almost nothing about traffic jams. Traffic jams are an emergent pattern. They surely depend somewhat on the nature of vehicles, and they depend somewhat on the urban landscape and the design of streets. But we can be surprised by the appearance of traffic jams, even if we are foremost mechanical expert on how to fix car engines or at the drivetrains of vehicles. It's not merely that that we are not familiar enough with the details of how a car works. It has to do with how all these pieces come together: the cars, the limited visibility of drivers, the nature of the road network. All of those things end up affecting emergence at the level of a traffic jam. So, the patterns that we see within these systems, these complex systems, are quite different from what we'd expect through any single component of the system. By knowing in detail about the natural history of infection associated with influenza, in isolation, you won't be able to anticipate the nature of flu outbreaks. You need to understand the connections between people, the networks that link them up. You need to, for some conditions, you need to understand aspects of care presentation. Here, we're often interested in understanding how these pieces add up to the whole so that we can reason about the effects of policies, counterfactuals that have never been observed before. And when we're dealing with complex systems, these systems where the behavior of the whole is greater than the sum of the parts, they really stymie us with many features that get in the way of behaving and managing them effectively. Some of these factors are counterintuitive behavior. They can surprise us. There are misperceptions. We can misanticipate arising reported incidents of a condition as a sign of a growing burden, when really it's a sign of better and better reporting of that underlying condition. We can be fraught with policy resistance. We undertake a policy, say, put in place rules that encourage the rollout of low-tar cigarettes, and find that we are smacked in the face by the fact that this has not gained us in terms of health. In fact, it's worsened the situation. We can put in place guidelines for sequestration that leave people at the mercy of a second outbreak as those people emerge without all being able to overcome their period of infectiousness. We can also be surprised by disproportionate impact of policies. Sometimes we may undertake an intervention that has far less gain than we thought, but if we undertake enough of it, it can totally qualitatively change the situation. It can be like night and day. A situation where a dementia ward is constantly fighting fires, trying to deal with the latest aggression which ripples through the community, versus a situation where, with the right nurse in place, with enough experience, it may be anticipated. She flies ahead of the plane, and she's able to keep the ward under control without having outbreaks that lead to these ripple through effects. So, when we have these complex systems, we have difficulty perceiving what's really going on, managing it effectively. We can get blowback from our policies, and we can be surprised in terms of the impact of our policies as we vary their level of their scale or their level of intensity. Because of this confusion, we often have problems associated with learning from experience. We put in place an intervention in Toronto, and we wondered the degree to which it could apply in Saskatoon. How would it need to be adapted? We have problems coordinating. Different people across the system may be working at cross purposes, or maybe failing to coordinate in a way that yields the best behavior for the system as a whole. This was cited, for example, by Don Berwick as one of the causes for poor health care system performance: over-optimization of sort of your little area of the system, but failing to coordinate across the system as a whole. And for planning and deciding, there's unclear trade-offs between choices. So system science, the science of the whole, seeks to aid reasoning about the interactions of causally tangled systems. And one of the central tools to achieve that, not the only one, but a central one, is through the use of dynamic models. These are models that try to capture the mechanics of the system, how it works in a causal sense, so we can ask about counterfactuals. So we can reason about why we see behavior, and we can ask, what if we put into place different policies, how would that change things? So by representing sort of how things might work, these are models that capture hypotheses concerning the external system. These models can help us learn more quickly from evidence. They can serve as laboratories for refining our thinking and help us share our assumptions with others. So what are these dynamic models that we'll be looking at? Well, they're tools for helping us represent hypothesized causal relationships between diverse factors that might govern the evolution of a system with respect to the features we care about. So they capture posited causal networks associated with a system. And having those in place allows us to examine system-wide consequences of intervening in one part of the system as it ripples out across the entire system. So if we could put in place a more effective vaccination scheme, for example, for healthcare workers, or if we change the level of prioritization associated with vaccination for flu, for pregnant women, and for school children, how would that affect the likely progress of an outbreak? Suppose we could put in place outbreak response interventions, or suppose we could put in place better after-school programs. How might that ripple through to lower truancy? How might it ripple through in terms of enhancing educational outcomes and in terms of enhancing the health outcomes over the life course that might be obtained by them? These sort of models help us and other system actors to understand vulnerabilities of the system, leverage points in the system, places where we could intervene that would secure the greatest gain or that would be most cost effective, and help us identify ways of more broadly changing the system structure, changing how different components of our system relate to one another. Perhaps it's the mental health system and the public health system, or it's criminal justice, mental health, and public health. To deal with frequent flyers in emergency rooms, for example, with mental health issues. So these simulation models will be talked about have many uses. At the most basic level, they help us explicitly represent our mental models of a situation, how we think things might work. So it's explicit. So we can put it out there, and so that other people can look at it, critique it, help us refine it collectively, and help us identify inconsistencies with our empirical observations. Very importantly, these tools are designed to assist in management of complex systems, not only in observing, not only in reasoning about why we see certain phenomena, but in asking what-if questions that involve counterfactuals, that where we don't have data collected directly on them, and we want to ask, what if we could put this intervention in place? What if we have this portfolio of interventions? What if we use this implementation strategy for a given intervention? How would that yield gains over time? What would be the time to effect? What would be the sustainability of the outcome? What would be the level of financial burden expected? What's the level of human resources required? So this is a tool for helping us reason and identify policies that are cost-effective, high leverage, and robust, to identify benefits of restructuring a system to improve reporting or feedback in a way that might improve system behavior, to understand trends, to prioritize research and data collection, can help point you to particular data items that are most valuable, and to understand classes and contexts in which certain strategies are best applied. In other words, to help us learn from one context to the other. Now, my perspective here has been shaped quite a lot by Jeff here. Jeff has referred to these models very convincingly, I think, as not just thinking tools, but thinking prostheses. And I didn't fully grok this idea until I broke my foot and sprained my ankle last fall. And I was thrown back upon the use of prostheses. I use canes or crutches and boots to help sustain myself. Why did I need those? I needed those to complement my limitations, to help me secure a higher level of functional ability in the context of my limitations. And so it is with models. We have limitations, and there's a remarkable literature demonstrating how poor we are as individuals in reasoning through about the behavior of complex systems. Even extremely knowledgeable, conceptually grounded, very well-trained individuals who are familiar with the ideas of complex systems are often really at a disadvantage in trying to reason through the implications of a set of assumptions about how a system works in terms of its behavior and in terms of how we could change things most effectively. So models are prostheses in this context. Models help us complement our limitations to achieve greater functionality. They help us learn more quickly by allowing us to think through implications of our assumptions about a system more consistently, reliably, rigorously, quickly, and thoroughly than we would be able to otherwise. If our understanding, our posited understanding of how a system works is stuck in our head, we're very poor in reasoning about it. But if we can put that understanding, that best guess, into a simulation model, not only does it allow other people to look at it and critique it and advance it, but it allows us to run that model and observe the consequences over time. And because these are complex systems, they often yield behavior over time that's very distinctive from what we might be led to believe by looking at the pieces of the system. So by doing that, we can then compare the results of those sort of runs against empirical data and try to use that to hone our understanding about what's really going on in that system. Where is our understanding off? Does it add up against the empirical data we have at our disposal? Or is the model suggesting that our assumptions should lead to a very different consequence, in which case we've learned something? It's not a failure of the model, it's a success of modeling. The fact that we have identified an inconsistency between what we think is going on and what the empirical data suggests that we would never have identified if it's stuck in our heads. So the idea here is with these models, we take our understanding of how things work out of our heads, we put it in an explicit form so that we can reason consistently with the help of the computer about what's the implication of that form, and we can, among other things, compare it to empirical data. So here, models, shown here on the lower left, help us sort of take a mental model, put it into a computational form, run it to see sort of implications, use those to sort of refine our mental model of what we expect, make observations from the external world that cross-check or question these assumptions, and use that to refine our mental model, which is then captured in an evolving computational model. This is the enterprise writ large of modeling that we seek to engage in. And a key component of this is this loop of observation, and that, ladies and gentlemen, will occupy us for the balance of the session. So here, this is observation and noting of discrepancies from model results and refinement of the model that's a virtuous loop. An additional component here that's especially valuable is undertaking actions, intervening in ways that have been anticipated by the model. So you think from the model's perspective, you've evaluated this, and you can see the degree to which the results match what the model suggests. So these models go by various names, and partly to kind of help link up diverse literatures you may have come across, stumbled over at one point or another. I'll note that they go by different names in different contexts. Sometimes they're called mathematical models. Sometimes, confusingly, in a statistical context, they're called causal models. They are also called mechanistic models, models of the plumbing or the physics of the system. These are mechanistic in the sense that they depict, they represent the hypothesized causal structure of a system. And they simulate the step-by-step evolution of that system over time so that we can ask what-if questions that have behavior over time. And because they seek to capture the posited causal structure of a system, they are designed to be used to anticipate outcomes for counterfactual situations, not merely for situations where we've observed data, although that's often valuable to build confidence, but also for counterfactuals. So just to give you a glimpse, models like this go back nearly a century in their compartmental form. This is a systemdynamics model that we built now a number of years ago and which has been evolved successively. But this is a model which depicts a population broken into into health categories, further by age, by ethnicity, by in utero exposure. And individuals, there's some count of individuals in each of these categories, count of normal and underweight individuals, overweight individuals with type 2 diabetes. And over time, for example, as a woman becomes pregnant, she transitions to a pregnancy state. As an individual gains weight, they might transition from a normal weight state to an overweight state. We have individuals moving between these categories. And this general form of mathematical modeling dates back to work of Ross and later of Kermick and McKendrick nearly a century ago now, century this decade for Ross. This sort of model can be used very broadly. This is an example of patient flow modeling that Kurt, who was here earlier, built for our Ministry of Health and shows various outcomes associated with care presentation, discharge, etc. There's another type of models on which I'm going to concentrate today that are also dynamic models. These models are articulated at an individual level. They depict one or more populations, and they depict those populations at an individual level. So we represent individuals within the population. And each such individual is associated with a set of characteristics. So one of them is they're associated with parameters, sort of characteristics of that person that are more or less constant for the scope of the model, for the time frame of the model. So maybe this is a model of an intervention outbreak, and you'll represent income as a fixed thing. You may represent a person as being of a certain ethnicity and a certain sex. They also depict state that evolves over time, the state of an individual. And we often will, in the modeling tools that we use, will indicate those states with state charts. So here we depict someone as being in a peritoneal dialysis state or hemodialysis. An individual may have a functioning kidney or have developed end-stage renal disease. An individual may undergo transplant over time and go through a series of stages which successively lower risk and cost associated with that individual. So here, the individual state is characterized. They're at a given state in this state chart and this state chart at a given time, and they evolve over time with respect to that state. Each of the individuals in this population. There's further a set of rules for evolving a state associated with those state charts, and they have a means of interacting with other agents. Commonly, these means of interaction are through networks of various sorts, spatial and character, or their interactions through factors such as cues. A related type of modeling that's more constrained, but also at an individual level, is discrete event modeling. Discrete event modeling captures individuals' flow through fairly well-defined processes, and those individuals, in contrast to agent-based modeling, don't typically interact with each other much. There's sort of a very simplistic assumption that the only way they interact is keeping each other waiting for certain resources to become available, waiting for the MRI to be available for them to get imaged, waiting for a clinician to see them while they're in the waiting room, etc. So three types of models there. What are the key take-home messages about these models? Well, these models express dynamic hypotheses about processes that are operating out there. These models can help us understand how diverse factors related to health combine to yield the observed patterns and how interventions might affect health or health disparities. With the right platforms, it turns out these models do support rich interdisciplinary collaborations, and that can enhance the rigor and relevance of this sort of modeling. Now, a major barrier to building these models is one that has confronted many of our projects, and that relates to the paucity of data concerning certain key factors for understanding health and health behaviors. These are factors associated, which I noted on the first day as a motivation. Factors related to location, which shapes, diverse components related to health: access to care, access to resources, exposures to recreational opportunities, barriers to physical activity, environmental risks. There's physical activity, which is certainly a key factor in shaping many chronic diseases, but is also of some relevance when it comes to certain communicable diseases. Spatial proximity, which of course is key when understanding spread of communicable illness, but is also very, very important for understanding imitative behavior, communication between individuals. There are studies that suggest that people to whom you are proximate have a much higher degree of influence given the same level of emotional closeness as people who are further away. Social context is of great interest due to norms, communication, perception of safety and risk perception, and communication between individuals. Finally, I'd put decision-making rules of heuristics. All of these have key places, or key puzzles in understanding the patterns of health behavior we see. Unfortunately, there's a paucity of traditional, reliable traditional data on a lot of these. There just isn't that level of temporal specificity, that level of temporal fine-grained data that we will need to inform models. And absent an understanding of these behaviors, the potential to really qualitatively evaluate many policy trade-offs is really limited. The models that we build may be capable of articulating theories at a level of specificity that way outstrips the data available, way outstrips our understanding of even what's going on at a theoretical level. So I had mentioned that when it comes to the sort of data that we've been talking about, data that seeks to fill in these gaps, that seeks to address many of these pieces, data on location, physical activity, spatial proximity of individual social context, what Kevin was talking about with networks earlier. Communicational context, something that we've examined with some of our studies by recording some aspects of communicational behavior. These are things we can fill in. Where do models come into this? Well, I talked about a hierarchy of models, and dynamic models were the highest level of this hierarchy, not in terms of their higher in the sense of privilege, but higher in the sense of in terms of the types of issues that are reasoned about within the model. And these models I highlighted as particularly being valuable for understanding the consequences of policy choices, understanding the distal consequences of observations that we may make, for example, concerning risk factors that might ripple through to changes in likely obesity over time. How might that ripple through to chronic disease outcomes, to even mortality rate in distal decades? They can help us evaluate interventions on the basis of learning from this data, and they can help us explain some of the data or posit generative explanations as concerning why we see the patterns we do in the sort of data that are being collected by these phones. Perhaps most importantly, these models can further serve as kind of theory-building vehicles more generally for kind of explaining what may be going on and underlying that data. So let's talk about these simulation models. I talked about several sorts of these models, both agent-based models and aggregate models. I'm not going to be talking about a third type of system science method, which we have applied some in our group, and I know Cheryl's applied, which are social network models. models where we are trying to understand behavior without representing agents in a full-blown way, trying to understand patterns of individual connectivity, potentially with some elements of dynamics. Many of those models can be fit into an agent-based context, but many have been articulated at a simpler level. So let's talk about how these models come together with data. Well, broadly speaking, the rubric is here, and it's a very straightforward idea. Dynamic models help us make sense of the data, as do other models in this hierarchy, and sensor data can help ground these models. And we'll talk about a couple of ways it grounds the models. They help tie the models down to empirical observations for now so that we can ask counterfactual questions with greater confidence that the model has some explanatory ability. So in more particular terms, they provide a database for parameterizing models, for putting in place within our dynamic models, for example, representations of contact network structure, or assumptions about how frequently contacts occur and for how long they occur. Alternatively, put into place estimates for model parameters associated with physical activity or associated with contact with grocery stores or associated with contact with parks or sidewalks. And these models can help us simulate simulate over time behavior of a system and thereby stimulate dynamic hypotheses that about factors that underlie the observed data. Where do dynamic models, so sensor data helps ground the model, where do dynamic models fit in? Well, they can capture process regularities that underlie that sensor data. They can help us understand the implications of sensor data for counterfactuals, for things we haven't observed. For what if we could put this into place? What would be the implications of a change in the hand washing habits within a long-term care facility in terms of how MRSA might spread within that facility? They can help us filter noisy sensor data by helping us to identify sort of consensus estimates that help balance the limitations of sensor data with a set of understanding concerning the nature of the processes that can help rule out outliers or at least secure better, more reliable data. And they can help us understand the distal implications of observed behavior. They can, to certain degrees, fill the gaps between sampled data points and identify sampling rates. This is not merely a matter where the models are downstream of sensor data, where the sensor data comes in and informs the dynamic models. That's a big part of the picture, but there's another component as well, in which is that these dynamic models can help us identify how frequently we need to sample and what we need to sample, and they can help generate synthetic data that will test machine learning models. I spoke about that earlier. They can help us test effective ways of classifying individuals. So how do these come together? These elements of big data and models. And what are the possible ways of combining them? We've explored a number of different ways. In some cases, we've used the sort of data that comes from sensors to directly place into the model. So there's a paper or two, maybe three, where we have used data that comes directly from the sensors to impose certain network structure within the models. So we're imposing empirically observed network structure that's dynamic in character. It plays out over time. Connections are made and broken in a way that's reflected in the real world based on sensor-based measurements. And we feed that into a dynamic model. We feed it into an agent-based model. Who is connected to whom? And we see the implications for something like spread of transmission of pathogen. Or it could be, equally much so, spread of norms, spread of knowledge, attitudes, and beliefs within a network. So here, the simulation model is serving to sort of directly take in data gathered by the sensors. We are feeding it with data that has been empirically observed to understand the implications for theories about how infection spreads or how norms spread, and we might observe how consistent the results are with empirical outcomes. That's a very common need. In other cases, we've calibrated the model to this observed data. The idea here is, ladies and gentlemen, there's many types of observed data that don't relate to any one assumption about the model. Rather, they are reflective of the interaction of many assumptions and aspects of model structure. They represent the result of a tangled set of processes. And we can simulate those processes in the model and see the degree to which the model output matches the empirically observed data. Maybe it's empirically observed data involving contact patterns as emerging from transportation behavior. Or perhaps it's aspects of physical activity as shaped by posited structure incorporated in the model, shaped by exposure to urban environments and to interventions that have tried to stimulate physical activity. Perhaps it's factors related to the spread of flu within the population, and we're trying to match the epi curve that we have observed empirically on cases of presentation with ILI, with flu-like symptoms, to emergency rooms against data from a model. These are not, we can't take this data about the observed epi curve and put it into the model. That's something generated by the model. It's something to which the model gives rise. It's something that comes out of the model. It's something that's endogenous to the model. We use different terms for it. But the point is, we can test the degree to which the model is consistent with those observations, at least the degree to which those observations are plausible given the model. Now, we've examined many particular formalisms for bringing together data and models. I'm going to be highlighting just a few of these in some experiments that we've run that suggest an important role for data in these models. But I will additionally note that, while I won't go into it in as much detail, that the sort of machine learning that William is working on, even as we speak there, that the work Narges has done in doing state classification, those hidden Markov models that occupied me not 3 hours ago at this very screen, those sorts of hidden Markov models can be very, very valuable for helping to cross-check the model's predictions. Because if we can, from empirical data, estimate the states that people are in, we can map those often fairly directly to the sort of states that are incorporated within these models. And this is a model involving health-seeking behavior and care processes, so it's less applicable. But for many of our models, we'll have representation of states associated with physical activity, dietary habits, states associated with beliefs, knowledge, attitudes, and beliefs, states associated with mobility, and we can match it to the sort of data that comes out of our classifiers as to someone's state, the degree to which they're taking vehicular transport or active transport, the degree to which they are purchasing more healthy foods or less healthy foods, the degree to which they're eating out or not. A hidden Markov model might do state inference, and we could use that to calibrate against the dynamic model to see the degree to which it captures the empirical patterns seen in the data as far as sort of identifying the underlying states for individuals. I'll also note that fact that I mentioned earlier, that these simulation models are very powerful synthetic ground truth producers. They produce sort of a set of data that can be very comparable to empirical data in which we could use to test, for example, inferencing mechanisms, hidden Markov models, naive Bayes models, support vector machines, if we wanted to do so. Narges is working on a very nice model, which is visually quite striking, for example, involving the spread of MRSA in nursing homes. This is together with one of Cheryl's students, and James, who was here but is currently elsewhere. And in this case, they are examining aspects of using that model to help plan the sort of monitoring behavior that is needed within a nursing home context to secure reliable insights into that context. Well, we've seen that, and I'm not going to go into that again. So this state classification, it aids development of dynamic hypotheses, helps us flesh out some of the dynamic hypotheses, the sort of causal structure that we might use in a model, and it can help deduce transition parameters or help us identify plausible parameters within the models, and also it provides data needed to calibrate these dynamic models. And I would particularly highlight here the availability of longitudinal data from the sort of sensors we're capturing. The fact that we're capturing data on an individual at a high velocity over time is very powerful for comparing against an agent-based model where we have a longitudinal representation of individuals within that model. So we can secure great gains from this. So let's talk about some of the interactions. I'm actually not going to talk too much about MCMC here, except to say that if we have at our disposal a large amount of empirical data, sometimes that allows us to take a dynamic model and much more reliably pin down the distribution of parameters within the model. We can actually estimate for different parameters in the model. One should be P and C here. We can identify possible plausible ranges of values and actually sample from values of P and C over time within the dynamic model in a way that will leave the model less vulnerable to misestimates, that will help us take into account the data. And the more data we have, the more narrow those distributions will be. But I want to highlight one particular use of data, which I've led together with Jushin Liu, that we found particularly strong in its implications. And this is the use of particle filtering. We have yet to actually connect this up to data from IEPI, but it's a very powerful rubric, and we hope to do so soon. Here, what we're actually doing is we're simulating a dynamic model over time in a way that simultaneously brings in data from empirical observations. So empirical observations are coming in over time. We're fusing them with model estimates to arrive at estimates of underlying latent states of the model, these states that we don't directly observe, like the number of infectious people out there across all of Saskatoon. Maybe what we observe is just those that have presented. But it can also help us identify parameters, particularly with particle MCMC, and identify a sample from distributions over scenario results. And for example, the gains of an intervention. One example context where we've used this is in the context of weekly reporting from the healthcare system associated with a number of cases of ILI. This is something Cheryl's been involved quite heavily and has helped to shape this application of particle filtering. And our goal here is sort of anticipating trajectory of incident cases and emerging outbreak and being able to ask critically what-if questions. And there's a variety of partners that we have who have expressed interest in this work. Right now, we're also doing quite a bit of work with data from Manitoba. So the idea here is that the sort of models that I've been introducing here can be very useful in responding to emergent issues. But often, if we're building these models, they can be very useful as thinking tools, but in terms of quantitative output, they can be compromised in the absence of some data to ground them. And at the same time, particularly for emerging conditions, we don't have time to build a model from ground up that's really, really empirically grounded. Often the data doesn't exist yet. Think about a new emerging infectious disease, for example. The observation here, however, is that even the most detailed models are limited. Even the most detailed models inevitably diverge from observations in the world. Models are like maps, ladies and gentlemen. Like a map, a model secures value by abstracting over details, by hiding a lot of details, and by capturing the essential details you need for a given problem. What that means is, like a map, a model will omit many features of the world that are in place out there, but are less germane to your needs. And like a map, the model needs for what it includes and what it doesn't include will vary depending on what your purpose is. If you need a map to drive across Saskatoon, that will be a very different map than if you wanted to jog across Saskatoon, or if you wanted to understand why brownouts are occurring in certain areas of the city or why flooding. You'd use different maps for those different purposes. And so it is with models. Like maps, models are abstractions. They hide a lot of detail. Like maps, the abstractions that they use are purpose dependent. So within this context, all models are going to have limitations. All models, there's no way a model is going to be able to anticipate the vagaries of, for example, how weather is going to change, when a heat wave occurs, when that snap of heavy cold will take place. They're not going to be able to anticipate that ice storm, which might strike every few years. And they're not going to be able to anticipate certain factors that will end up influencing the evolution of health, which might depend as much on the economy as other factors. And so models are inevitably, even the best, most sort of evidence-based model is inevitably going to diverge from observations. So it is with our own forays into the world. Many of you in this room have an intimate knowledge of how to get home from here or how to get back to your hotels. You have a very good mental model now built up as to what you need to do to get home. But even though that model is very, very rich and very well built up and very grounded, it would be extremely hazardous for you to attempt that journey with your eyes held shut. You're going to end up in a world of hurt. You're going to walk across the street when the light is red, and you're going to get hit by a vehicle. You're going to be misjudging exactly where the curve is, and you're going to fall, and you're going to break a rib. You could end up running afoul of the construction going on and end up in a manhole. It'll be extremely hazardous, even with the most refined mental models, to attempt to navigate the world with their eyes shut. Both our mental model and observations are needed to get us home safely. And the question is, why do we build blind simulation models? Why do we build models that, once we build them, we operate them without ongoing data coming in, just like we secure through our eyes? So the vision here with particle filtering, which is really very, very doable, and which we've realized for a number of models now, is the idea of building a rough and ready adaptive model and then having data that comes in over time to keep it current, to keep it grounded, to ground it in the latest evidence, to tie it in with empirical observations about what's going on now, so we can look forward and ask those key what-if questions. So, for example, we've used this. This is actually not the latest data. So I think Aiden, if he's in the room, he could probably provide me with the latest data. But this is an example of particle filtering, early example from Manitoba. We have some much more compelling visuals now from that, but which basically show models projections as new data comes in. It's adjusting its projection of the current situation so that it can project forward, so we could ask, well, what if we put in place now an outbreak response intervention? What would the result be? The model here is very imperfect, but every time a new data point comes in, it is combined with model estimates to yield a better understanding of what's likely the case. And we gain from this distributions, as it were, we gain the ability to sample from distributions over the number of people in different states, for example, the number of people recovered, the number of people who are vaccinated, the number of people who are completing latency and entering an infectious state over time, and also the ability to estimate certain parameters that are shown here. So within this context, we have a model, and the model is being matched by data coming in. And this, ladies and gentlemen, is where the is a key point for the incorporation of data from sensors. Because that data from sensors, I argued earlier, exhibits the 4 V's of big data: the volume, the variety, the veracity to be sure, but also the velocity. It's temporally frequent, and it can help us tie down aspects of our models in a way that is much more often than would be possible through a lot of traditional data sources, which might be updated once a week, might be updated once a month, according to reporting guidelines. So in this context, we have a great prospect for tying together dynamic models, even rough ones, with incoming data from one or more data streams that will pin down aspects of that model, keep it current, keep it to the latest evidence, but use that model's ability to ask those what-if questions looking forward. Tie down its estimate of parameters as they might evolve over time, and use those estimates in those latest estimates to provide the best grounded assessment of what the trade-offs might be between different policies. So here, particle filtering and other techniques like it, it's not the only one. We've also used, in conjunction with Kevin, Kalman filtering, for example, that using data from the sensors, which is absent here. But the general principle is having an incoming stream of data that ties in with a model, grounds that model, and then using the model to be able to ask what-if questions in a way that doesn't require manual calibration. Okay, I'm not going to be going into the details of particle filtering, although if there were questions on this, I'd be happy to do so. There's some fascinating mathematics with it, but it's highly applicable. So I should note that we've evaluated these techniques using, in fact, this example of a simulation experiment. So, for example, using an agent-based model, and it might use, for example, sensor data. And here we have synthetic ground truth that's provided from the agent-based model as to what's really going on. But we have some simulated measured data that could be used to feed into a particle filter together with a dynamic model to arrive at some estimate of the current situation, and that then is combined back to this model to estimate as new data comes in the current state. And we've evaluated using a situation like this, although not specifically of particle filtering with sensor data, to compare with the impacts of not using that data. And one of the real insights that's come from the most recent iteration of our particle filtering work, and this is stuff I need to discuss with Cheryl, is the fact that much more frequent data, even if it's noisy, can be quite a bit more robust and effective in terms of its allowing you to identify what's going on than less frequent but less noisy data. So getting data, for example, daily, it can be much, much more valuable than getting it weekly. And I would argue that it's very likely that getting sensor data on an ongoing basis, say multiple times during a day, could be especially valuable in grounding a model. Just continuing to talk about this, I think I'm going to go into one, to finish this discussion with a provocative finding from some of our work that's still being refined. Winchell is going to be finishing up some some heavy lifting on this in the following week, and these are very preliminary results. But this brings up the possibility that this sort of data can not only be very valuable for dynamic models, but it may in some cases be a necessity. So the observation here is, high-resolution sensor data of the sort we've seen can be fairly easily gathered. It's not without its challenges, but the degree to which we can collect that data is markedly increased compared to 5 or 10 years ago, and it's becoming easier over time, and it's becoming richer over time. And this data can be cross-linked with other publicly available data sets, such as weather data, GIS data, and can inform these sort of models via parameterization and calibration. And so the question that was asked in this study was how much spatial temporal accuracy is required to really secure material difference in model accuracy. Do you really need data on contact patterns on the basis of every minute, every few minutes? Or is it adequate to measure it every few hours or maybe every day? If you could get a statement on a daily basis of people's contact patterns, maybe that's enough, for example, to capture the spread of transmission of infection through a population. And, is it possible that these novel data sources of the sort we've been working with do not confer significant benefits to model accuracy compared with traditional approximations? Is it possible that they don't help, that using a lens that includes these novel data sources, these electronic data sources, will not appreciably improve our understanding of, say, how a pathogen transmits through a population? So to investigate this, Kevin and I and a number of graduate students, including most notably Winchell here in the back, the king of data analysis, we've conducted a variety of what are called data knockout experiments informally. The idea here is that we have recourse to a set of data, and this set of data is collected at a highly temporally fine-grained nature. So it may be recorded every 2 minutes or every 3 minutes contact patterns. And what we did is we ran a simulation model using that data, posited as the contact patterns. This is a simulation model based on H1N1 transmission, based on published estimates for parameter values, plus some of our own work are simulating H1N1 in the local context. And then we took successively what we call downsampled versions of this data. We knocked out some of the data. So instead of sampling every 5 minutes, maybe we sample every 10, every 20, every 40 minutes, every 80 minutes. Suppose we weren't sampling nearly as frequently, how would that change the implications for the spread of, or the perceived implications as far as how the flu spread through this population? If we only had data that was sampled once a day, would that change our perception of the burden, the likely burden of flu within that population? And to conduct this work, we, for our experiments, we ran the model many times because of the stochastics involved, because sometimes there'd be a discordant pair of people, one infected, one not, where it would transmit, sometimes not. And to account for the stochastics, we ran it many, many times. And we compared the results of those runs with successively less data included against the results with the entire data included. The idea was, okay, it's not to say we have the perfect data set now, but suppose we had only, a far less of the data. Suppose we had only half the data. Would that materially change our perception of how flu would spread in the population? Within this context, this is work that the very first model of this sort Mohammed had worked in, but it was drawn also based on modeling by David Fissman and Ashley Tuet and others at U of T and elsewhere. As Kevin noted in passing and mentioning this work, we did examine implications of aggregating and the implications of examining downsample data as well. This is actually an earlier study where we were looking at fitted network data, and we found that aggregated data yielded quite different results than fully detailed data. So if we aggregated up at the level of a day, we secured some quite different results, about perhaps almost twice the level of burden of infection as if we simulated it with fully detailed data. And we did so using different days as kind of typical days. We imagine the impact if we only measured one day of data and we assumed that all days were like that, how variable would the results be from the fully detailed simulation that we had secured using about 3 months of data, and as much precision as we could secure it? And the answer was, well, all those different ways of summarizing over basically using different days as typical could give a wide variety of different results. No one day was typical. We also paired up here, as I recall, a weekend day and a weekday. So we had sort of a representative weekday and a representative weekend day. Suppose we had only collected 2 days of data instead of 3 months. And the answer is we could be really fooling ourselves. It's almost as bad as assuming the typical person in an epidemiological study. You know, we'll just study one person and assume that's a typical person, which lacks full credibility from an epidemiological standpoint. In the second study, we actually examined the sampling frequency. I got a bit ahead of myself, but here we actually knocked out the data samples. And these results have been supplanted, but the general pattern is similar, that sampling every 5 minutes, the most detailed data, got us a certain observed burden of over time of flu. Sampling every few hours gave us a very, very different picture. The knee of the curve was a little bit different, I think, in the latest results. Winchell and Kevin can remind me, but I think you needed to sample at least every 15 minutes or something on that order, I thought it was. But indeed, and I'm coming to that. This is for the default disease that we were looking at, which was based on the settings from the H1N1. It was for H1N1. For different conditions, for different pathogens, you see very different pictures based on how frequently you sample them. And this was results from several years ago that, again, has been supplanted. But suffice it to say that if you have a very slow-moving bug, sampling so frequently is probably not necessary. But if you have a bug that's moving quite quickly, Norwalk virus, for example, or H1N1, sampling at the level of minutes may give you very different results than sampling at the level of hours or days. So what this is saying is a little bit sobering. What this is saying is that for this case, where we have models in place that are based on literature, based on fairly well-regarded models concerning H1N1 transmission. If we took those models and adapted them to work with sensor data, and we were to ask how valuable is that sensor data beyond traditional measures of contact networks, the answer is it can be very, very important for certain pathogens. Very, very important for the spread of certain pathogens. Not all, but very, very. If you have TB, which exhibits a very, very long latency, for example, probably simulating every few minutes people's contact patterns is going to be a wash. You don't need that. There may be exceptions to that, but with something like TB, it kind of smooths things out over a long period of time. Something like Norwalk, something like H1N1, these things can move very quickly, and actually the extra resolution secured through sensor data is actually very important to secure reliable insight from these models. Now, we did this in a domain, transmission of infectious disease, where the data is more pinned down. When it comes to transmission of knowledge, attitudes, and beliefs, when it comes to transmission of norms, when it comes to imitative behavior, when it comes to the impacts of environments on our day-to-day work, the impacts of those encounters that might inspire us or otherwise in terms of our dietary intake, in terms of our physical activity. Do we need this sort of a microdata? Do we need to record our contacts and exposures every few minutes? When it comes to environmental epi, our exposures to household chemicals, our exposures to adverse air quality, do we need this extra resolution? I would argue the jury is still out on that. But if we don't have the lenses afforded to us that will give us that level of resolution to let us do these data knockout experiments, we may be at risk of assuming that we can deal with more aggregate data and find ourselves, flat on our back when it actually turns out otherwise. So I would argue that this sort of study puts a big challenge up for those of us that are seeking to provide policy relevant advice on issues as to, be careful about how detailed your representation is of certain processes in the world. It may be that you think aggregating is safe, but it may be that you're fooling yourself in the sense of you'll get very different results, like by a factor of 2 or 3, if you assume, if you have recourse to very detailed data or if you don't. So, in terms of implications for the data we're collecting here, it may be that 25 years from now, 50 years from now, people look back on this era and think that, we were trying to pick up screws with boxing gloves. We were trying to distinguish effects based on such crude aggregate measures that we would not be able to pick up the salient features. We would not be able to pick up that texture of people's lives that led them to be exposed by various influences that went unmeasured, unquantified, and therefore under-examined in the analyses, and that led to conclusions which were shaky as a result. It may be that with this new type of data, we will be able to sort of recognize that for certain contexts it's very important. There may be other contexts where, like for TB, we recognize, this level of resolution is not needed. We don't need to collect contact patterns for TB at the level of individual proximity, at the level of minutes, but we may wish to do so for the level of capturing where people are. Their spatial locations, which may be important for mixing, understanding where they spend their time, which it can also be very poorly self-reported. So these data knockout experiments have been sobering, and while this exact picture has been evolving quite a bit, and while Windchill is leading the charge in terms of adapting this to new types of data, and while Kevin has a beautiful screen image, that wouldn't hurt. If you'd like to speak about that, you'd be most welcome to do so. Yeah. Okay, this is hot off the press, I guess, eh?
Well, this is more like back in the pot.
Okay.
So,
okay.
That is actually from work I did on my during my sabbatical when I actually had time to program all by myself. Unfortunately, when I program all by myself, I make mistakes. So these are off by slightly declining constants, but I think they get the point across. This is what Windchill is fixing right now. My code. Oh wait, that's wrong. So this is shed 1 contact network, and this is flu, so H1N1 flu. We've done this for many other pathogens. And what this is a downsampling. So the first one is 1-to-1, so it's the full contact network. Next one is we take every 8th sample, make the network that way, but then we compensate to say, well, it's 8 times as long, right? So now every contact that you record, instead of being 5 minutes, is now 40 minutes.
So you're kind of getting snapshots of who's in contact, and you're assuming that persists
to the next,
because you have no reason not to. Similarly, 1 to 64, and then 1 to 512. This is basically the number of samples we skip.
probably can't read it here, but the first one is every 40 minutes instead of every 5 minutes. Then it's every 5.3 hours, so kind of 3 to 4 times a day. And then the last one is every couple of days. And what you see is the difference between 1 to 1 and 1 to 8 isn't enormous. There's a lot of kind of gingerbread filigree stuff, low probability contacts where things get transmitted that are captured in the 5-minute interval, but are gone in the 40-minute interval. But the basic shape of kind of who's infecting whom remains the same. As you go to the 64, to the kind of 4 times a day, we're still catching the really big contacts. This is you getting sick from your kids and coworkers, but we're missing those novel.
The person you were next to in line is caught.
No, that's gone here.
That one?
This is more like the hour-long meeting I had with Winchell. Right now, that's now gone. My kids are still here, and the fact that I was in the lab for 3 hours or whatever, that's still here. So the kind of gross behavior of the transmission exists. Once you go down to this once a day, though, it's pretty much gone. There's no correlation. It's just garbage, right? So it's not just what you can know, it's what you need to know, right? So if you're content with just kind of a rough sketch of what's probably going to happen in your population, then a few times a day will probably get you most of the way there, right? This is kind of like the cartoon version of my infection. If you want kind of the more Mona Lisa style painting of what you're going to get, then probably every half hour or so is something more reasonable. This is for flu too. Keep that in mind. It changes based on the. And then finally, if you really have to know all the possible ways this could ever happen, then you need to go all the way down to the 5-minute level, or perhaps below. That's the duty cycle level that we aggregated to. So that kind of sums up what's going on.
So there's a question of how well this carries over to other contexts. I mean, I would ask, in terms of measuring people's exposures, whether, for example, assuming that someone's exposures are shaped by their home neighborhood where their residence is, are we more in a situation like compared to a situation where we consider their full activity space, their empirical space where they go day in, day out, where they're spending every 5-minute little chunk? That has exposures associated with it, which are occurring at a very detailed level. The question is using their home location and home neighborhood more akin to this, or is it akin to that, for example? And similarly for understanding aspects of their the influences on them, limiting it to influence of family or limiting it to aspects associated with education. Are we impoverishing things too much? The point is not that this is necessarily representative of all health research, that, it's a choice between this and this. The question is, right now, we don't know which health questions require this sort of detailed sampling and which don't. Which things will put a real premium on this and for which it will be less important. And to answer that question, we make use of dynamic models of the sort you've seen in the simulation experiments. This is a key way that these models can come in. They can help us determine what sort of sampling rates will be safe, and even potentially what sort of information do we need to make reliable decisions. They can serve as this kind of testing ground, this kind of sandbox for trying out different strategies and seeing how reliable the results are if we use one lens versus another. And it is for that purpose that we see one of the biggest uses of these sorts of simulation models. So I want to finish up here so that we have plenty of time for our work with our teams. But as a broad term, coupled with models, sensor data can offer really significant and complementary insight. Use of machine learning techniques like particle filtering can really enhance the power of dynamic modeling. And I would finally highlight one feature that I really should have mentioned, for which I should have had a slide, but for which I stand in front of you neglectful. One might even say negligent. And that is models like data, I argued, are both key for learning from interventions. And one of the key parallels here that I want to emphasize is these sort of models, like data, will typically depict multiple pathways by which, say, an intervention secures various outcomes. And with these models, we will commonly represent various feedback loops involving different features. It's reciprocal causality as well as linear causality. But the point is that within our simulation models, we can simulate the effects of interventions as they might play out across multiple pathways. Think back to that example associated with move from a low income to a medium income neighborhood. That move, we could actually have a simulation model that would simulate the effects of that move, the effects of greater availability of grocery stores, the effects of greater availability of sidewalks, better sidewalks, an improved built environment for supporting physical activity, ball courts, aspects of safety that support high levels of physical activity, and in a food environment that's much more supportive. And we could simulate that in a dynamic model and simulate the effects of an intervention like that as it plays out over diverse pathways. We could see in our model which of these pathways are the strongest in mediating the effects of the intervention. We could do that by turning off certain pathways and seeing how it affects the results of the intervention. And then we can compare that, again, similar pathways as quantified by sensor data. Okay, are they going to the grocery store? How much of a change in diet? How much time are the kids spending now eating at home versus outside? How much physical activity are they getting through accelerometry and through heart rate monitors from the Mio watches? We can pick up aspects of mobility, of physical activity, of dietary behavior, of sedentary behavior, of family groupings, using a model and using data from smartphones. We can compare those, and we can more quickly learn about model deficiencies that we can improve, and thereby improve our mental model. It's not just about the dynamic model captures our mental models. We best understand the situation, and we can improve our understanding by catching discrepancies between what it depicts and the observations from the world depict. That helps us refine our understanding of the world, very important. But it also helps us identify where the intervention might be going off and reason critically with a dynamic model about what would happen in terms of the intervention gain if we were to intervene differently, if we were to complement it with a different type of intervention or separate it out from the portfolio of interventions with which it's working at cross purposes. If we were to give it more time to have effect, take into account the implementation science barriers that it ran into. These are things that we can help reason about as counterfactuals with dynamic models. So dynamic models form a particularly key step when reasoning about the effects of interventions, and they complement our ability to monitor different pathways using sensors with our ability to monitor different pathways using dynamic models. So we can learn more effectively about our understanding of the world and learn more effectively about the effects of an intervention and more effectively from even interventions that don't work, because we know which pathways are not being nudged and can reason about how to improve our interventions using the model. So that is, I think, a major potential contribution of models that I stand before you negligent for not emphasizing in this presentation. So finally, I'd like to just acknowledge many others, including Kevin, Jushen, and others who have worked with me on this and related factors, and a variety of funders. so those are the comments that I had prepared there. I know it's a lot of information. For those not familiar with dynamic models, it's probably, you know, a lot of it may not have really resonated, but I'd be happy to answer any questions or to point to some examples we've built of where we've actually integrated this sort of data into models. So thanks very much.